guys, welcome back to Medical Coding with Blue. Today's episode is all about should you take the medical coding job. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, now if you are coming from a different industry and you're coming over to medical coding or even the health information field, and you're wondering if you should take the job or not. And I know sometimes it's a little hard, especially if you've been in a certain industry for many years and you're so used to that industry, to take that leap of faith and go into a new industry and one that has a notorious reputation for not being kind to new people, as far as they give them a hard time about getting hired, but it is possible and it's just you can't give up and so on and so forth. But this industry is notorious for that. And if you can get past that, which I always encourage my audience to do so, if you can get past that, you are in for a wonderful career if you allow yourself to develop and grow in this field. I have. This is a passion for me. Now, I don't feel like I'm working when I go to work. Yes, there are chore things that I have to do at work that make it work. But for the most part, I don't see medical coding as a job. It is a career. So I got a really good comment from a viewer a few days ago, and I'm going to read this comment. And I think that it can resonate with a lot of people because medical coding welcomes people from all walks of life. So a lot of people who are perhaps on their second or third career getting into medical coding are going through this. You know, they're wondering, should they or shouldn't they? So I'm going to read the comment and we're going to get into it. So here we go. All right, so the comment goes, and thank you to the viewer who posted the comment. Hi Blue, I mentioned on another video of yours that I recently got my CCPCS. I am working through Practicode and plan to finish as you advised. I'm almost 58 years old and currently a flight attendant. I really want to work as a remote coder. I have an interview on Monday for a medical billing and coding position on site. I will see how the interview goes and if I get an offer or not. But if I do, should I take it? I'm not in desperate need at the moment as I am employed, so I don't want to settle. However, this office seems like a great opportunity with great people, so I'm praying about it. What are your thoughts? So I think the viewer kind of answered her own question, and I understand kind of like wanting to have my thoughts on the situation. But the thing is, it really is ultimately your call. If you are going to be leaving a particular industry that you've been in for so long, I know that it's hard, but you also will notice about yourself is that you chose medical coding for a reason. There's a reason that you're trying to leave the industry. There's a reason that you're trying to move on from there. So you have to really kind of think about that too. It doesn't happen by accident that you go through a program, you complete your program, you get your certification, and now you're in the job hunting process. That doesn't happen by accident. That is a force from you to get out there and really find something. Now, finding your first job and it being on site is best for all brand new medical coders. Eventually you can get to the remote part because I always recommend for brand new medical coders that you work at the facility. Now, before anybody says, but I started off as a remote coder and I did just fine. That's okay for some people, but it's not okay for the vast majority of people. So if that was your experience and you got a job right away as a remote coder, that's fine. You know, the pandemic changed the landscape of hiring brand new medical coders. When the pandemic started, they allowed brand new medical coders with no experience to work at home remotely. Before then, you were not getting hired brand new to work remotely. You had to have experience. And there was a reason for that. You know, to work at home remotely takes a lot. You know, it's a lot of trying to figure things out on your own, problem solving. You can't run to somebody anytime that you need help. You really have to figure out a lot of stuff on your own. And it takes a lot of research and dedication to reading in order to achieve that, you know, to be able to get where you need to go when you're coding remotely. But as far as this goes, this position, being on site, it sounds like a great opportunity, she says. The thing that I would look for when I'm choosing to go somewhere else is, of course, I'm going to look at what are they offering as far as like what kind of productivity are they expecting? How long are they going to expect for me to ramp up or get used to the systems and meet my productivity? How long will they give me? A lot of people don't understand me when I say ramp up. So ramp up means there's a period of time where you're learning and they're not holding you to standards, but after like 90 days, they're going to expect for you to be at full standards and, you know, as far as accuracy goes and productivity goes. It's different everywhere, okay? But I would be very careful with the productivity. Productivity is really huge with brand new medical coders and with any medical coder. Now, I was very clear in my last video, but let me say this again. If the place that you are applying is between, the productivity for outpatient is between 80 and 150, this is okay. This is a good average productivity per day that you should be at. 150 is a little high, but if you are in a repetitive clinic, if you are in a clinic that has very little codes, very little variety of codes, like a psych clinic or even coding for PT and OT, physical therapy, occupational therapy, they have very limited code selections that they use on a daily basis when they're in clinic. So it's fine if you have 150 as your productivity if you're working in something like that. If you are working in a specialty clinic, you want to see about that productivity being a little bit lower. I work in a specialty clinic. I work in 2 specialty clinics at that. I work in orthopedics and podiatry, and my current productivity is 90 per day. So I'm able to achieve that. I'm able to hit that. And if I go higher, I go higher. You know, there's going to be days where you're going to produce more because the documentation is really on point. And there's going to be days when you're not going to be able to do that. So it really all depends. You don't have to meet this every single day, but you do have to have an average. And that's typically what employers are looking at is average. Now, if they're telling you, hey, our productivity is 200 per day, that is a no-go. You are not even coding at that point. You are just pushing things through. Now, keep in mind, you are responsible for everything that you are submitting. If you are selecting those codes, you have to be able to respond to why you selected those codes. Not that they told me to code it this way, the doctor selected these codes, or somebody else selected these codes. It doesn't matter. If your name is on those codes that are being submitted, you are responsible for those codes. So this is why I say if it's 200, that's a no-go. Do not do it. I can't be more clear than that. If the job is 200 plus per day, and I've seen them try to do that with 320 for the ER, which is ridiculous. How can you ask medical coders to code 320 per day? Oh, well, you're just pushing through and verifying everything that's already been selected. Doctors are not medical coders, and they are not meant to be medical coders. They are meant to document and take care of patients. We are responsible for the code selections. So I do not trust that providers are always going to select the correct codes 100% of the time. And you can't tell me, oh, well, AI and the electronic medical record are selecting the codes. Again, artificial intelligence is only as smart as you're telling it to be. So unless that artificial intelligence is reading the provider's mind in this electronic medical record, again, all of those programs are looking for words. It's not smart enough to know, okay, well, this is this and this is this. Because again, the program is only as smart as you're telling it to be. So again, if you are applying for these jobs, find out how much your productivity is. The second thing is, are you working from a work queue or are you assigned to a particular clinic? If you are working from a work queue, everybody goes from the same pot, everybody goes to the same list and just checks off an encounter from there and codes it and goes on to the next one. That's also a no-go. I recommend that highly for brand new medical coders, any medical coder, that you do not work from a work queue. As far as like everybody just picks and then goes from there. What happens is a lot of times people will skip, and you can't tell me that people don't skip, because yes, they do. No matter how sophisticated the program is, there will always be medical coders who will figure out a way to skip. The problem with skipping is that brand new medical coders often get stuck with the more complicated ones because everyone else has figured out how to maneuver the system. So if you don't want your first experience as a medical coder to be a bad one, you want to go in a place where they're going to assign you to a clinic. This way, you are responsible for that clinic. Everything that happens and everything that comes into that clinic is on you. So because it's on you, now you are responsible. And I think when you have that mindset, like, okay, this clinic is mine, and I'm going to have to learn everything I can about it, and I'm going to learn this, I'm going to develop relationships with my providers because I have that opportunity being on site. That is a great opportunity for a brand new medical coder. So you want something like that. You want something where they're going to assign you to a particular thing. If they say, well, you know, we need help in OBGYN, we need help in ortho, we need help in the ER, you know, that's fine because that's a specific task that they're assigning you, but not this, everybody goes to the same thing and then you pick from there. I worked for a level 1 trauma hospital remotely many years ago. Now, I had been an experienced medical coder at the time I had started working at this trauma hospital, but the problem was I worked in the evening, whereas everybody else worked during the daytime. And because I worked in the evening, I often got a lot of the leftover stuff that everybody else picked over and didn't want. So I got left with the really hard stuff. Now, it didn't bother me because I'm okay with the challenge, and I had a wonderful boss who understood that I didn't always meet productivity because some of these were really difficult. This is a level 1 trauma hospital, so there's a lot of really complicated things that happen here, and there's a lot of intense surgeries that I had to code as well. So that's something that you really want to kind of look out for as a brand new medical coder. Yes, you want to get a job, and yes, you want to get started, but you really want to make sure that you're being started in a place that's going to set you up for success in the long run and that you are really going to like it. When I worked on my first job at the Cancer Therapy Research Center, we had stacks of paper records to code. We did not use an encoder. We had to use our books because we were working on backlog. So when we're first there, I'm there with two other rookies, right? We're all brand new. No, this was our first job. And after a while, one of the girls actually started to learn to pick through. She's like, okay, she could spot the really easy ones. So she took those out of the pile and put them on her desk, and she was able to work through. And of course, she's flying through and making her productivity. However, me and the other rookie are like, I don't understand, like, how are you flying through all these records? And then it was like, okay, well, she's kind of shuffling through and getting out what she wants to code and then leaving the bad stuff or the harder stuff for us. It does make you a stronger coder when you do work through the harder stuff, but at the same time, you do need a little bit of a break when you are a brand new medical coder. And as far as like, you're going to meet those challenges, but at the same time, you shouldn't have to be stuck with all of the hard stuff. So that would be something that I would ask about productivity and about accuracy. Accuracy being, okay, how long are they going to give you to get up to speed? If there's something in particular that's going wrong with what you're selecting, is there an auditor or is it the supervisor that's asking you, that is not asking you, but is coaching you through that time? You know, keep in mind, when you walk in there, they are going to expect for you to already know how to code. So a lot of times brand new coders fall into that trap of, who is going to train me? No ma'am, no sir. That's not the way that it works. So it doesn't matter how fast you went through medical coding school. It doesn't matter if you didn't learn that in medical coding school. Now it's on you. That is what this field is. This field is a lot of independent learning. It is a lot of, you are trying to find your own way, and you do have to find resources, and you do have to find that you're going to do a lot of research. So that is something that you have to keep in mind when you get into this field. Now, yes, it is important to be comfortable where you're working and know that you're going to do a lot of grunt work in the beginning, and you're going to get stuck with a lot of the hard stuff, but nothing is hard or difficult if you know how to do your research, okay? I got thrown into the same-day surgery clinic many years ago. I had started off, of course, at the Cancer Therapy Research Center. I had done professional fee coding as my next position, and that was where I was. And all of a sudden, I get thrown into the same-day surgery clinic when I got moved to a new supervisor. That was a gift from my parting supervisor. And that's fine. You know, she knew that I had no experience in working in same-day surgery. That's okay. I learned very quickly. And so how I learned was I started Googling. I started looking at surgeries on YouTube so that I could better understand what I was reading. It started to make more sense. And that was another challenge that I met and walked right through. You have to walk through challenges in faith, people. I mean, if you're out there and you want to be scared for every single thing that's going to come up against you, as far as like, oh, I don't know if I can code in that clinic because that's too hard. No clinic is too hard because you've already passed your certification exam, and this says that you are competent to code anywhere, believe it or not. So that is where I will say that. And let's see if I miss anything. So if you are not ready to leave this position, whatever position that you're in, and if you find that the position that you are applying for doesn't really sound like something that you would want, I think you've answered your own question. However, if you have decided that you want to move on by a particular time and you want to see if this is going to work, keep in mind that as easily as you got this job, you can easily get another job in medical coding, or you can easily get another interview in medical coding. So that's the thing. It's not just the one position that you'll ever see, okay? There is a bunch of opportunity out there, but it does take you to be proactive. You know, there was a couple of months ago, there was a young lady that was, we were communicating back and forth, and she had left a position that was clearly, they were not appreciative of their coders at all. And so she went and she was applying for a job. She found a job, and then she had an interview for another job. And she's like, well, should I tell them? I said, see what they're offering before you just foo-foo this other place. They offered her more money, and you know, she had more opportunity there. So of course she declined the first one and she went with the second one. So there's always going to be opportunity out there. She would have potentially missed out on a really good chance had she just said, okay, well, I already got this one job, you know, why do I need to go and interview with this other place? Well, if you have your resume out and people are calling you, it's not about getting into a bidding war to see who's going to pay you more. It's about seeing who's going to give you the best opportunity and the best chance for success. And that's something that you have to be able to gauge in a very short amount of time by the people that you're meeting. So that is something that I'm going to encourage you guys to ask questions. Pay attention to the people that are interviewing you. Pay attention to their body language. Pay attention to the inflection in their voice. And when you ask them questions, don't ask them, how much vacation time do I get? Because it's not about you at that moment. It is about getting you into a good position that is going to give you the best chance and opportunity for growth and success, right? So if you ask them, what is your productivity? What is your accuracy expectations? What is the work situation like? Am I in an office by myself, or am I working with a bunch of people? And if you are working with a bunch of people, you can certainly ask if you can kind of stick your head in and see what you're see what you're up against. See what the environment is like. If you go into a room and it's hot, it's a good chance that that room's always going to be hot, you know. And once you get in, you know, you want to make sure that you are comfortable. So find out where you're going to be working. Ask what the work situation is like. Ask who you're going to be reporting to. Those are good questions to ask, because if you have an issue, you should be willing and able to go to your boss, to your supervisor, and see how your boss or your future supervisor acts with you when you are in this interview. Because if they are snarky, that's pretty much how they're going to be. And before people say, well, you know, sometimes people have a bad day, it's a very, again, short amount of time that you're going to get to make a decision on if you're going to spend time at this place or not. And they have to be as willing to accept you for everything, but you have to be as willing to accept them. So if you get that bad feeling all of a sudden, then that's okay. You can go through the interview, but I would say to consider that decision very carefully before you say, well, yeah, I want to spend time with this person, or no, I do not want to. As a experienced medical coder now, I know what I will and will not tolerate from people. And there's a lot of strong people in this field. There are a lot of rude people in this field as well. And there are people who are professionally developed, and there are people who are still developing. So you need to make sure that you are aware of that. And it is about how you are able to respond to a lot of these things too. So if you are willing to work with all different types of personalities, get ready, but again, make sure that you look at your surroundings, look at what's being offered, and of course look at the compensation package, but do not let that drive you, because the money will always be there. When you are going into these positions, the money will be there eventually, and you may not see it right away. Obviously don't go for something that's low and insulting. As far as like your compensation package, every place is different. I've never given a solid number on a dollar starting salary, because every place in the US is different. So if you want to know about your area and what a medical coder makes in your area, the Department of Labor or the Bureau of Statistics has that information on particular professions. So you can look that up there. So that is something that you can do as part of your research. So that is my message for today. So best of luck to you if you're out there and you're considering these things when you're trying to interview and deciding if you want to leave where you're at, okay? Just because you get this position and maybe it doesn't work out, it's okay. You can always find another one, all right? But make sure you ask questions. Productivity, accuracy, how long is the ramp-up period? What is your office situation like? Who are you reporting to? What kind of opportunities are there as far as like continuing education units? That is very important. Some employers offer them and others do not. So that's another thing to kind of keep in mind. So I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, I hope that you will like it, share it, subscribe if you haven't already, and I will see y'all next time. Bye.